Okay, it looks like we have our whole crew of panelists with us now, so we can go ahead and get started. My name is Heather Deer, and I'm the Director of Parent and Family Programs here at William & Mary. This is our final webinar in our Fall 2023 webinar series, and we're ending it appropriately with talking about this busy time of year, final exams, and how you all can support your students as they prepare for and live through and process final exams in the end of another fall semester. So with that, I will turn it over to Lindsay Heck, who will introduce our panelists and kick off our conversation. Lindsay?
Hi, everyone, and just welcome to all of our families. And thank you so much for taking the time to join us on this webinar today. I'm Lindsay Heck, the Integrative Wellness Manager at the McLeod-Tyler Wellness Center. I'm here along with some of my colleagues from our Health and Wellness team. Health and Wellness at William & Mary is a thematic area of student affairs, and we provide an integrative approach to the healthcare of your students. We have 4 departments integrating multiple disciplines and professionals, and all of whose work creates a model that provides multiple portals of entry for students to manage their stress and distress. Our services span the continuum of education, prevention, and intervention services. And so here with me today, representing all of our departments, we have Karina Sidarsky-Gleiser of the Counseling Center. We have T. Davis, who is our Director of the Office of Health Promotion. Linda Knight, who is the Executive Director of Health and Wellness and the Director of Campus Recreation, along with David Dafishy, who is the Director of our Student Health Center on campus. So the mission of William & Mary, we bring together the brightest minds for a better world. We've got a strong sense of pride in our beautiful campus and our vibrant community. And this is a community that everyone here today is a part of. The pursuits of our mission require our community to work together in support of our values. And amongst those values, of course, is excellence. We've got about 75% of our students are in the top 10% of their graduating class, and as supporters of them, you know firsthand the dedication that's required to reach that level of excellence. The students on our campus, the time that they spend here is a period of extraordinary personal growth and meaningful accomplishments. And while we work to shift the remnants of stress glorification culture, we know that stress is cultivated from that strong sense of care and passion while they're engaging in the things that they truly care with and value. And we all need healthy coping strategies, but if we don't have those or don't put them into practice, what happens? So burnout was first coined as a term around the mid-70s. Initially, it was very focused on professionals within the healthcare industry. And then over the course of time, it's really become a hot topic word. And Dr. David Dafishy is going to talk with us a little more about what burnout really is.
Well, thank you, Lindsay. I appreciate that. So, I will start just by saying, I know how I feel at the end of a busy semester and how drained and exhausting, my work can sometimes be. And I speak with the students on a regular basis, obviously as patients. And, I identify, one major difference between my life and theirs, which is, every day at 5 o'clock and every Friday at 5 o'clock, I sort of, for the most part, can take a little bit of a break and I can recharge my battery. There are things I have to do outside of work and certainly stay credentialed. But unlike a student, I sort of can turn things off and turn things on. And a weekend can truly be restorative for me. Whereas for a lot of these students, and I certainly remember being one, but for a lot of these students, studenthood is sort of it's one of those vague professions where you're never really quite finished, right? And there's always something more that you feel like you can be doing. And much like a gas tank will eventually run out of gas, you can run on fumes, but you can't run on empty. That's really what burnout really is. Burnout is a psychological phenomenon that basically means you have spent so much time in a chronic state of stress and strain that you really don't have, you really have nothing left. And at times you can feel sort of a lack of passion, a lack of that enthusiasm and that sense of joy that may have defined your actions earlier. So burnout is basically sort of the result of a chronic state of stress without an adequate amount of time to decompress or to recharge, right? A rechargeable battery can last forever if it continues to get recharged periodically. But anyone who owns an electric vehicle knows that if you don't recharge it, you're not going to be going, you're not going to be going very far for very long. Next slide, do you think? So, I talk a little bit about sort of signs and symptoms of burnout. And before I do, well, actually, I'll save that for later. But I think, the big one is really just you're physically exhausted. You feel like you have no energy left. So you may feel feelings of fatigue. At this time of year, we have a lot of students who come in just complaining of feeling tired all the time, wondering if they're anemic or, if they have some other vitamin deficiency. But in a lot of situations, it's really just, physical and mental exhaustion from all the hard work they've been doing. The second cardinal feature of burnout is really a sense of emotional or mental distancing, where you feel like the relationships that you may have had for whatever reason are not nurturing anymore, or you're not maintaining those relationships with others. And the final result is that of just difficulty to, staying focused on the task in hand, difficulty with concentration and attention, and the result is reduced performance. One of the things I would, not to get out of turn, but one of the things I would sort of start by talking to, any student about is the idea of certainly validating what they're going through, but at the same time, maybe offering a sense of perspective. So, I think at this point in the semester, it would be fair to ask your student, how do you feel about finals? What are your thoughts on that? I know it's going to be a tough time. You must be a bit stressed about that, and that's okay. But also offering the perspective of somebody who's not really fully immersed in it, which is, you and I know that, the exams are important and the grades are important to them, and we want them to do well. But it's not an end all be all. It's not, if exams don't go as well as you would like, while disappointing, we want to still say, you've worked hard this semester. We're proud of you. You should be proud of yourself, the work you've done. And if the results are not exactly what you want, while we acknowledge that may be disappointing, you're still a William & Mary student with lots of wonderful options, right? And you're still in an enviable place compared to the vast majority of the world. And so I think having that perspective and understanding all the wonderful things that you've done should not be undone because an outcome is not precisely what we want it to be. So I think as long as we all have hope, that there's always tomorrow. We really kind of can avert some of the that sense of being overwhelmed and hopeless that can sometimes come when we lose perspective and think that everything rides on our finals, right? A lot does ride on these finals, but everything does not ride on your final exam. So acknowledging the difficulty, acknowledging their desire to do well, complimenting them for a job already well done, and preparing them for the possibility that, there may be some occasional disappointments and we don't always do exactly as well as we want. But, persistence and perseverance is more important, than even your performance on one given day or one given semester. Again, just a couple of physical and psychological responses. These are young, healthy people, for the most part. So we talk about a higher risk of cardiovascular disease in people who have chronic stress in their lives. And this is indeed true, certainly probably more relevant as we go into middle age. But, again, these are times when we're trying to develop healthy habits. And the way that students manage stress as an 18 to 22-year-old may actually, in a lot of the situations, may actually reflect how they're going to manage stress later in their lives. And so I think, just understanding that managing stress healthfully not only affects our mental health, but can actually prolong our lives is something worth remembering. Musculoskeletal GI complaints, certainly upset stomach, muscle aches, fatigue, headaches, lack of sleep, inability to sleep. These are all very common things. Depressive symptoms, which largely can relate to lack of sleep. We know that serotonin levels dip when we don't get adequate sleep, and depression medications are not effective if you're simply not sleeping. sleeping because you're effectively draining the medication right out of the body. One thing I don't see on this slide, which I think is really relevant to the young, healthy population, is immune suppression. So people, obviously hand washing is important, but if you're not sleeping and you're stressed out, you're going to be much more likely to contract upper respiratory infections, which aren't going to be life-threatening, but can certainly make it a lot more difficult to navigate the exam period. So again, staying healthy physically is going to help you stay, healthy mentally. And again, the basic building blocks of wellness are easy to ignore when we get into that crunch time. And it's really ironic because the time that our body needs those building blocks the most are the times that we're most apt to tend to abandon them. So getting 8 hours of sleep, getting some aerobic exercise, healthy nutrition, eating a proper diet, finding some time to decompress and to take a mental health break from studying. We know that people who draw creatively in the 30 minutes before an exam actually do better than people who try to cram up into the last minute. So again, what I call the basic building blocks of wellness: adequate sleep, proper nutrition, regular exercise, and working on stress reduction through pleasurable pursuits. Those are the four things that a lot of times people abandon in those 3-week periods when they're at the busiest, and those are the times when they can actually pay the most, in terms of dividends.
And Karina, with some of the responses to burnout and these stress responses mirroring some depressive symptoms, at what point would you encourage parents or for students to be aware of, is this burnout versus is this depression?
Thank you, Lindsay. And I want to add an additional couple of symptoms that students may experience right now, and that parents may be aware of, is symptoms of anxiety in addition to symptoms of depression, right? With the anxiety of finals, and maybe irritability, because when you feel depleted and burnt out and anxious, it's very easy to feel very irritable. So what I would recommend is that, I wouldn't want students or parents to have to, be the ones diagnosing or having to differentiate what is what. But if, generally speaking, if a student were to not experience these symptoms, after their finals, well, it probably was burnout, and it probably was a short-term level of anxiety that was congruent with what was going on. If they were to be more long-lasting, right, that would be then more concerning and potentially more of an issue of more a clinical depression or a clinical level of anxiety. But we don't need to wait until, the third week of December or later for students to seek help if they are feeling that the anxiety or the depression or the level of burnout, lack of motivation is really interfering with their lives and their well-being. So it is important to know the resources that students continue to have at this time. One, with all the programs that are being offered at the Wellness Center, what I'm hearing sometimes from students is, well, I don't have time to exercise. I don't have the half hour or 1 hour to go to yoga because then I lose so much time for studying. And as David was saying, performance actually good in lack of sleep and lack of that motivation and energy that exercise can give you, or sense of peace of mind, will actually interfere more with performance than if I study an hour less, right? Or half hour less because I engage in mindfulness exercises or went to yoga. So again, our students, I many times feel if I do sleep the 7 to 8 hours, then I'm not studying sufficient. But we know for a fact, the research shows that if you don't have enough sleep, your performance is going to be negatively affected. So yes, much better to take into account those, engage in those healthy habits that David was talking about, if nothing else, for performance sake, and hopefully for more than that, for that healthy body, healthy mind in a way.
And I think our students will really start to feel that sense of burnout during this period, but it's not something that just starts in this moment. It's something that really is an accumulated sense of pressure throughout the course of the semester, where students are having high demands in their course loads and that limited sense of time and managing social responsibilities and activities. And so there really is that preventative piece where working for that time management element, committing to those foundational pieces of well-being are going to be those preventative factors. And then also the limited coping skills. We have a lot of resources here on campus. We view our wellness center truly as a learning center. And along with the student recreation center, there are so many opportunities for students to really find their niche and what it is that resonates with them, to be able to discover what it is that is healthy for them, that they enjoy and want to incorporate, and then to be able to put those things into action and put them into practice.
Can I add, sorry to interrupt you, Lindsay, that, also research shows that 20 minutes of aerobic exercise, we are not talking about, 1 hour, hour and a half, 2 hours that students need to be at the campus recreation center in order to feel the positive impact of exercise, but just 20 minutes of aerobic exercise would make a difference in the level of endorphins and symptoms of lack of motivation, lack of energy, and depressive symptomatology and anxiety. So just wanted to add.
That's a great point, Karina. And I would just add, that I think that speaks to sort of the idea of perfectionism, which is, some folks say, if I can't do a 3-hour intense workout or run 10 miles, then it's just not worth it. Right. And the truth is, like you said, that is absolutely not the case. Every little bit counts. And a small dose of exercise can be highly effective, just like, small periods of studying for 45 minutes can be highly effective and sometimes even more effective than 4-hour study jam sessions.
Yeah, and as the person who's the recreation director, I'll share a little bit more of that, but I've also got the section on breaking the stress cycle. So I'll cover a little bit in that area, but Karina and David are correct. And as I listen to them talk, I get a little anxious because I'm getting ready to say some of the same things, but what's really important for you all to hear, which we so strongly believe in, is you're hearing it from a trained psychologist, you're hearing it from a physician, and you're also hearing it from the recreation director. So we're all coming at it from a different perspective, but you're hearing the same information. And I think it's really important that you understand what your students get here is very different than they get at other places, because often, you'll go to a doctor and the first thing they want to do is give medicine, or you'll go to a counselor and the first thing they say is medicine. And here we don't do that. We look at different approaches and different portals for the students to enter. That doesn't mean a student doesn't need medicine from either one of those areas. It just means that's not always the only answer we give. And that's really a benefit for our students here, because that does not happen everywhere else. And that's one of the things that really helps set us apart from a lot of different institutions.
So how do you support your student doing burnout? Because if they are burnt out, then, like, they got to get through it. Like, the prevention part is gone unless we're talking about secondary prevention. So the first, recognizing burnout. Now we talked about, and I say we, David and Karina and all, we talked about different being irritable, insomnia, all of those things. But when, like, a lot of students don't sleep anyway, so it may not look different. So it might just come down to you asking, like, how do you feel? And then they might say some things that's like, okay, that might be burnout. Do you feel like you burnt out? And so having those conversations Do you feel like you have low energy? And then setting realistic expectations. Um, you may not get an A, and it's okay unless you just need that A to pass the class. I hope not many of us are in that situation. But if you pass the class, at the end of it all, that's the goal, is to pass and leave with a diploma. They don't put a GPA on a diploma, and so if you can, I understand you want your student to have 4.0s, but all of us on this panel know that nobody's ever asked us about our GPA when we went to apply for a job. So sometimes we pressure because we want our students to be the best and we want them to be successful, but a B is fine. Sometimes that's what it is. Statistics, I was horrible. I was happy to get that C so I could pass and keep it moving. Um, so setting realistic expectations, and also as we were speaking, understanding. It's probably many valuable nuggets, but sleep. Sleep to me is probably going to be the number one at the top of if I had a top 5 list. Why? Because when you are asleep, the short term information that you have learned through the day goes into long term memory. And if you're not sleeping, none of that memory and that information, all that information is not being transferred over. And so stand up really, really late studying and not getting the accurate amount from 7 to 9 hours of sleep is not going to be beneficial to all the work that you did during the day if you're not getting sleep. Diet. Like David talked about immune system, that also affects our diet. And so drinking a lot of caffeine, I'm gonna stay up. Well, then when you actually get ready to sleep, caffeine blocks our adenosine portals, which means you can't go to sleep because all that caffeine got to wear out of your system. So talking to your student about like, what are you eating? What is your plan? I always tell students, if you fail to plan, you plan to fail. So ask them, what is your plan? Like early on, before the final start, I've asked several students, and many of them have a plan. They have papers they're going to work on this date, that date. They're going to study on these dates, and that's a way to be successful, is to have a plan and to try to build into that plan. Like I'm going to eat, because a lot of students will say they forgot to eat, and they only sleep when they get totally exhausted. But building sleep, building going for a walk, building going to grab food, and don't isolate yourself where you just by yourself all the time. Having time with your friends is important, and that might just be a study group, because if you teach the information, you know the information. So if you're with a bunch of people and you all trying to teach each other and um, review the material, it can be helpful in learning, especially new material that you may not have studied, because you just don't know what's going to be on the final. So um, study groups are really helpful. Control the controllables. Some stuff is just out of your control, and so you find the things that you can control and talk to the student about what can you control, and then proceed from there. Setting boundaries. This is something that we talk about quite often, but sometimes you're just gonna have to say no to some things, because people will still make requests on your time, and that might be, do you want to run out and do something that's not beneficial to you for this next 10 days? We actually have like 9 days of finals. They got a couple of reading days, which add up to about a week, 2 weeks. But and then just communicate. And I often tell people to talk to yourself like you talk to your friend. So you never tell your friend you're gonna fail. Oh, you awful. This is gonna be the worst exam ever. You got this. That's the way you should have talk to yourself. Self talk is very important. And so, anybody have any additions around the healthy communication expectations?
I think it's really too part of that heightened sense of burnout during the exam period is T mentioned the control piece of it. And I think our students walk the streets of campus with a very strong sense that their future is the outcome of their future is within the hands of a professor. And talking about the type of student that we have here on campus, high performers who have definitely had a long record of success. And then that sense of uncertainty as you step into this exam and feel just very uncertain about the outcome. And the stress glorification culture, there's so much of that is present through those means of communication. And just to, again, reiterate, those are the pieces where you catch yourself in those negative narratives, or you find your student speaking through those negative narratives, or I stayed up this late, I was at swim until 3 a.m. Those are the pieces that we absolutely would encourage you to push back on.
Okay, so I'm going to talk to you a little bit about the breaking the stress cycle, and I where I love this, I don't love the title of it, because one of the things we talk so much about is stress is not bad. Stress is actually a healthy it's a healthy process. It's if you don't manage it, it becomes bad. So we all want, I mean, stress shows passion. And so how do we manage that stress so that it doesn't get out of control? And as we talk to you about some of these things, I think it's important to understand that we're really talking about the majority of our students. We also know there are a group of students that probably are from an anxiety standpoint, on a different level, and they need a different set of guidance, maybe with how we handle these, or maybe the students that really aren't taking exams at all seriously, and they need a little bit different kind of motivation. But we're talking about the students that just find exam weeks to be just overwhelming, which I completely understand. Again, it's been a while since I was in school, but I do remember exam weeks and never thought they were healthy for anybody. And so our goal is to try to help you understand how to help your students manage that. And I love the way David talked about burnout, is because we all get it, but we have to recharge. And what is it you can do to recharge? And that's what we're kind of talking when we talk about basically breaking this stress cycle. And everybody's talked about nutrition. You've got to eat, and you've got to eat healthy, but that's not what we do. What we do is we go grab the quickest thing we can get, because we don't want to be away from studying for more than 30 minutes, or we don't want to sleep. And we've really worked hard, as Lindsay talked about, with the stress glorification of, well, I stayed up 8 hours. Well, I stayed up 10. Well, then I'm going to stay up 12 because I'm going to one up everyone. And we really have worked hard on getting people to change that mentality, and how you do that. And I was talking with a group of our students that work for us, which we have about 250. And I was talking with them, and the thing, I taught them all these things. And I said, you're going to graduate from William and Mary. If you get a B in a class, that's not the end of the world. Take care of yourself. And when we did the evaluation, when we said, what was the one thing you remember the most? And they were like, it's okay if I get a B as long as I take care of myself. That's not exactly how I wanted them to take that, but I was okay with it, because I felt like that's important for them to understand. It's not just about the grades. There's so much more they get here than just what they learn in the classroom. And that's part of what our health and wellness thematic area is about. We understand people enter that stress piece under very, very different portals. And how can they do that? Both Karina and T and David have all talked about the importance of physical activity. It's so important for us that we keep our rec center open and our wellness center open during this time, because we know our students are stressed. We didn't used to offer classes like wellness and fitness classes during this time, because our philosophy was students needed to be studying. Well, no, that's not true. So we do offer those classes so that student can take. And some of our classes are 15 minutes, some of them are 30 minutes, some of them are 45, an hour. So they can take whatever time they can do. There are many studies that show if a student is exercising during a stressful time, they're going to do better in that area. So we can certainly show plenty of studies that say if you are doing something physical during this exam period, you're probably going to do better on your exams. Because it wakes you up. It helps those endorphins. It helps you study better. But it's counterproductive to our mindset. Our mindset is, if I take time away from studying, that's going to hurt me. In reality, if you take time away from studying and do one of these exercise, whether it's physical exercise, whether it's emotional exercise, any of those things will help you do better once you go back to the studying. But that's just, it doesn't make sense, but it works. And so that's really important for you to help your students understand that, because they don't necessarily get that. And I understand why, but we try to preach that. It helps us if you can reinforce that. Kind of how can you help during this time? You know, when you talk to your students during this time, hopefully their first question isn't, how did you do on the test? Or are you studying enough? Because we know they've already put that pressure on themselves. Maybe ask them, what are you doing to manage your stress during this time? How are you taking care of yourself? You know, what can we not what do you need, or how can I best support you during this time? That's a nice way to get them to open up to you about what's going on with them. It is a hard time. It is a very stressful time. How do we get them to understand? But that's okay, and it's short-lived. And I also like that David talked. I think it was David that talked about, or Lindsay, what to do once they come home. You know, once they get their grades and they're disappointed, don't go, oh, you failed. That was horrible. I'm not failing the class, but you didn't meet my expectations. Maybe say, hey, what can I do to support you to help you feel better about this? Because that's already putting a lot of pressure on them, and they need your support to help to get them through a time that is a little bit difficult for them. We've got a lot more years of experience in our minds than our young adults do. So to help them understand how to navigate that is really, really, really helpful. We also, again, we offer a lot of different classes during this time. And again, some are short, some are long, but it's also okay just to go out and walk for 10 or 15 minutes. I think we talked about 20 to 30 minutes of physical activity is plenty, but it doesn't have to be done all at once either. If you just take a brisk 10-minute walk and then come back and then take another one later and then take a third one later, that's equally as important. It really does keep that mind active and moving. So they don't even have to give up a half an hour at a time. I think, and they don't have to come to the rec center, and they don't have to go to the wellness center. They can do that wherever they are, wherever it feels important to them. Hopefully some of you on this call have seen our area down at Lake Matoka. Just to walk around there, if nothing else, even studying down there for a half hour will change their environment of how they are looking at that book very differently than if they're in their residence hall or in swim library. And I hope what I want to make sure you're not hearing is that we don't value the academic part of all that goes on during exam weeks, because we do. We know how important that is, but we also know there are things that have to happen for them to be able to be as successful as we all want them to be. And when they graduate from here, if they've learned how to manage that stress, that's just as important as they've learned that calculus formula. So I think it's important for them, because once they leave here, this is the time to learn that, just like it is the time to learn their English and their math and their history, as how to take care of themselves. So those are just some ideas we have. I know Heather has mentioned the newsletters coming out to you all, I think next week, and we will have all of our activities that we're doing during exam weeks in that newsletter. And so you can go on there, and if your student says, well, I just can't find time, you can say, oh, but look, there's all these times. I know the rec center is open at least 10 to 12 hours every day. So there's plenty of time for students to come in. I know the wellness center is open all day also. So there's plenty of times for students and spaces for students to find ways to take care of themselves, not just around activity, but around nutrition. And you've heard it from all of us, and we all know it's one of those things we can't always do, but that sleep is so important. You know, we know we don't ever talk about work-life, or we try not to talk about work-life balance. They're in a time right now where they are trying to find harmony between life and studying. And that harmony might be that maybe it's 70% studying and 30% everything else, but that 30% needs to be productive. And I think that's the piece that we're really trying to get across to you all, and how you can best help your students through all this. So that's just a few areas that I'm happy to cover. And I think I am the last one, or maybe Lindsay's going to talk about all the campus resources. So I will turn it over back to her, and we'll answer any questions at the end. So thank you all for listening to us and hearing the same thing over and over, but that tells you that it's important to all of us and coming from different perspectives. That's a pretty neat concept. Thank you.
Thanks, Linda. And, as our body responds to these stresses that we experience, we feel this physiologically within ourselves. And there's that piece of just completing that stress cycle where we're moving the body into that physical state and allowing these beautiful neurochemicals to release in our mind and create those shifts in their physical spaces that provide so many more benefits from cardio health and beyond. So we are approaching, next week is Friday, our last day of classes. And as Linda said, we're preparing for all of our fitness and wellness schedule we'll be releasing for the exam period. We have a lot of fun pop-up sessions. We've got Taylor Swift yoga, we had Barbie yoga recently. We've got Doga, where our therapy dogs come into our space and students are able to have their practice and enjoy their time with our pet therapy partners here on campus. Initially, we didn't want the Wellness Center to be a study space. We thought that would not be happening here, but we know our community and they are definitely popping in here. But the beautiful thing about your students coming into the Wellness Center to spend those healthy periods of time studying is that we've got so many opportunities for breaks built into our spaces with the classes that are happening morning, noon, and night between the meditation, the art therapy, and the various other physical movement sessions. Will also be present over at swim, and we'll be sending that information out for you all to share as well. Your students look to you for support. You having that understanding of where to go on campus is very helpful to be able to share that information when your student finds themselves in a tight space. I did include the student accessibility services on there. They're not within our spectrum of services. Those academic accommodations that students can apply for now, honestly, is not the best time to put those applications into place. Karina and David could talk a little bit more about that. There is a period of processing that needs to be done, but also important to note as your student navigates this space. Karina, did you want to talk about the counseling center a little bit and the services?
Sure. And before I forget, in terms of student accessibility, I agree with you, Lindsay, that at times it's much better to go through the process kind of in preparation for the semester and have the accommodations that student needs. However, I think it's important also to know that a student can have temporary, right? A temporary accommodation. For instance, if they suspect they have ADD, or they are going to go through some testing, but in the meantime, they could benefit from certain accommodation. My understanding is that because we met recently with student accessibilities, and they are able to provide temporary until a student gets actually, say, a diagnosis or the testing done. So that is always something important to know. At the counseling center, we offer individual therapy, group therapy. That's also something that students interested in group should try to let us know at the beginning of the semester, because those groups, are actually in the process of ending right now, but it's an excellent program, especially for students with social anxiety, so that they can practice being with others and being vulnerable and being able to get feedback, because everyone many of the students in the group are feeling, oh, I'm for sure being perceived a certain way. Or I'm sure that people don't understand me when I trying to share my information, and being able to notice that that's not the case is very helpful. So please, when you hear that we are recommending group, is for a good reason. We also offer we call it urgent meetings. So if someone is experiencing a time-sensitive issue, or an emotional crisis, they can just walk into the counseling center and be seen that same day. Also, I think it's very important for parents to know that William and Mary has the contract with Timely Care. especially also at this time in the semester, is really important to know that because once the university is closed, the counseling center will be closed. However, Timely Care continues to offer counseling through the break. And so if someone were to start therapy right now, I would really recommend Timely Care. One, they could be able to fit the student in right away, maybe within a few days, and then be able to have the therapeutic support through the break. And then they obviously can continue next semester if they wanted to continue with that. They also offer what's called Talk Now. So a student who may be experiencing, again, all of a sudden anxiety while they are at swim library studying, and all the symptoms that they are having are interfering with their ability to concentrate and study, they can contact Timely Care, the Talk Now feature, and talk with the therapist right away. It doesn't matter at what time of day or night or weekend that may be. For other type of emergencies, more serious emergencies, after hours, we recommend that students use our same phone number, counseling center phone number, 757-221-3620, and they can connect with protocol. Basically, they would connect with a professional, a counselor who is very skilled at managing crisis type of issues. So many options for students, through our services. Thank you.
Another great feature of the Timely Care are some of the modules that they have in the resilience building. So in that preventative piece, maybe starting to prepare for the spring semester, developing coping strategies and resilience. There's some wonderful modules available that students can work through. There's also health coaching that's accessible through that Timely Care app.
And Lindsay,
yes,
I'm sorry, go ahead, Karina.
I was going to say for instance, health coaching could be someone who is interested in a smoking cessation, right? Or someone who realizes, yes, I didn't sleep, my sleep hygiene was really bad this semester, and they can start even now working on improving sleep hygiene, motivation for exercise, things like that. So that is extremely helpful, as well as the self-help modules that Lindsay was talking about. I wanted to add that all these services that I'm talking about, the counseling center and the Timely Care, are free for students. Well, they are already included in the health fee that students pay each semester. Linda, your services are free at the campus recreation, unless it's more personal trainer. You can talk more about that. But many of the services offered also at the wellness center, including yoga, mindfulness, etc., are also already paid by students. Because
and I think that's what I was gonna say, Karina, is that all the things that Lindsay talked about and Karina just talked about are free for students. And you know, I always like to make sure parents know that when we talk about the fitness and wellness classes being free, we say a lot of things are free, but they're in your tuition or they're in somewhere. These are genuinely free. It was a gift of two individuals who we've named both buildings after, but they gave enough money so we can always offer free fitness and wellness classes to students. And it really is, it doesn't come out of anything you do. So if we knew money was a barrier, we've taken that barrier away. So if they say, well, I just can't afford it, but that's not true because it's free. I was going to add that.
Yeah. And just for what it's worth, the Student Health Center works slightly differently. We do have free in-house labs. We have a laboratory that does a lot of moderate complexity labs. That's free of charge. We have a full pharmacy that that does bill insurance, very competitively priced. And then we really don't bill for visits per se. We have a fairly nominal office fee, which tends to be less than the copay of what you would pay if you went to see a primary doctor. But we do have a visit fee of $25, and that's just an upfront fee. But other than that, we Like I said, we provide in-house labs for free, and we process insurance for outside labs and for pharmaceuticals. And we do see patients up till the break, about, for just any kind of reason, physical issues, mental health issues. We sit down and we counsel students. We don't always start medication, as Karina and Linda had mentioned. We don't always start medications right before the break if we don't feel like it's something that's appropriate. We know that medications can take a few weeks to work, but it's never too late or too early to start a medication if we think it's indicated and the student feels that it's indicated. So there was a bit of a myth that we don't see mental health in the last week, but that's not true. We see patients, for any and every reason up until the end of the semester. Were there a few more questions in the chat that we should maybe look at?
We do have a few questions. So I know we have just a few more minutes on everyone's maybe lunch break that they're spending with us. So I'll touch on a few of those. And families, if you do have questions that we don't have time to cover today, you can always send your questions to our wellness email, which is here on the screen, but also to families@wm.edu, especially if it's a question outside of the wellness realm, if it's more about academic support or anything in that nature. I'm happy to triage some of those questions for you. So one that stood out to me was, how do you recommend families have a conversation or maybe push back a little bit if their student is talking about staying up all night studying and they didn't make time to go eat dinner, or they haven't stepped into the wellness center or campus rec in the last week? How can families start a conversation with their student that doesn't contribute to the stress that they're experiencing?
I would say to really be very honest and say, I'm aware that it's so stressful this last part of the semester and all the exams that are coming up. Probably what I'm going to suggest is very counterintuitive because it is. But, again, we are aware that, or I am aware that, there's a lot of information about the impact that exercise, sleep, a good nutrition has on retention and on performance of material, concentration, ability to focus, and that there is a lot that demonstrate that. And also the opposite, that when someone doesn't sleep well, sleep deprivation, when someone is trying to study for hours and hours and hours without a break, is not productive time. Yeah.
I would agree with that, Karina. And I would also say one other thing. I think it's great to couch it in terms of performance and remind people that they will perform better if they're healthy. But I think about my own 10-year-old daughter, and it's like we talk about health, and like, what is more important than our health? I want a healthy child. I want a healthy family member, right? Your health is more important than your GPA. I'm sorry. And so I think you would never, at least I would never take some mind-altering drug that I knew could damage my health if it made me run faster. I mean, you would never do that, right? And so I don't understand why people engage in unhealthy behaviors that can affect their longevity, can affect their physical health, their mental health. For what? For a grade? Like, I would just emphasize, as your parent, as your family member, as somebody who loves you, I want you to be healthy first. And I want you to perform to the best of your ability, but no one can perform their best if they're not healthy. And make it about health first.
And
I would really
definitely second. Oh, I'm sorry. I would definitely second that in the sense that you can take a little pressure off. And I don't know, I'm not saying any of you all are doing this, but if you're putting a lot of pressure on your students to get great grades and do this, maybe say, hey, I really want you to do well, and I want you to do it in a healthy manner. Maybe you're already doing that and they're not listening because there is that culture here, and I believe that to be true. So I'm trying to answer a question when I don't know where you all are coming from exactly, but understanding that you can take a little pressure away by saying things like, hey, it's okay if you don't get straight A's. we want you to be healthy and we want you to succeed at William and Mary. And that doesn't necessarily mean being the top of your class. It means graduating and coming out with a healthy lifestyle when you leave there.
I think that's a great point, Linda. And I think even if parents and families aren't having those conversations right now of I want you to get good grades and I want you to make A's and I want your GPA to be incredible, sometimes students can internalize and perceive pressure that doesn't necessarily exist. So I think even just having a conversation right now about, GPAs are cool and all, but we really love you and we want you to be healthy and happy. And that's what's important to us. And it may seem really obvious, that statement, we love you and we want to see you when you come home and be happy and sleep for 12 hours. But I think just simply saying it right now can be really meaningful for students. You may not feel like you're putting any pressure on them, but students can put a lot of pressure on themselves, and just getting that little permission slip from you to care about their wellness can really make a big impact. And I also think listening to this conversation as parents and families is just a fabulous reminder that our students are always watching us, and us taking steps to take care of our own wellness and to model the ways in which we're working against preventing that burnout and taking care of ourselves can really be a great space for students to watch and learn as they're growing and becoming independent adults. And this is the perfect time for them to model some of those behaviors. So I think it's always great for us to take what we're hearing about student wellness and think about how we're caring for our own wellness and how that impacts the way that students perceive how important it is to care about their health and well-being. So great points there. I think one other question I would have is just, I know there is a calendar coming out of all the fun things that are happening during exams and all of the great workshops and classes that are happening. But if you could give families one tip, one tool for them to have in their toolkit as they start to have conversations with their students over the next couple weeks, what is the one workshop, the one fun thing is coming up on the calendar, or just the generally one piece of advice that you would give families as they start to have these conversations with students?
I would say download the William & Mary Wellness app, or encourage your student to do so if they haven't already. We have taken the time to design that wealth of information that sits in the palm of your hand. And it truly has been thoughtfully planned, so that you have access to the resources at the counseling center, the health center, and all of the classes, the trips, and pieces that are available to your students through campus recreation as well.
I guess I would say just let them know, one, that you support them on how they get through this, and that it's okay to take care of themselves. I think Heather said it beautifully. We assume they know that, but from sometimes what we hear from the students, they don't always know that. They're acting out of fear instead of authentic excellence. They're afraid to not do something, and let them know that they don't need to be afraid of you all if they don't maybe get the exact grades that you would hope they'd gotten, as long as they do it in a kind of a healthy way. And certainly would second Lindsay's the wellness app, because there's so much stuff there that if they all of a sudden have 30 minutes to take a break, they can find something to do in that 30 minutes, and that's really important.
I would recommend to ask about, tell me how you're balancing things out. Okay, I know you're studying a lot. Tell me about what are you doing for fun, or what are you doing to socialize and connect with others? What are you doing in terms of your rest? What are you doing in terms of exercise? I'm thinking about the different areas of life and how they are managing, because that sends the message, right? We care about your whole being and not just performance. And I want to add that when I was talking how to, in a way, convince them about the importance of sleep and issues like that, and I went with the research on performance, is because I'm very aware that, at times students are not thinking about longevity and those important pieces that Dr. Dafoshi David mentioned, but because they are so focused on performance. So if nothing else, right, if they could care really about their well-being and their health and all of that, awesome. But if they are going to put, I don't want to hear about that. I only want to hear about my grades and my performance. We have enough information to be able to hopefully make it make sense for them in that regard. But yeah, issue of balance, issue of we care about your whole being.
Okay, any other final thoughts before we wrap up?
I have one final thought. And I offer this not only for you to talk to your students, but for you as well, parents, to have a wellness mindset, and whatever you do it for the well of it.
I love that, T. And I'll also add, since I haven't spoken on this, just getting back to what we were talking about earlier, life really is a journey, and it's a marathon. It's hopefully a long journey. And just asking ourselves the question, we know what we're putting into life, and we know what we know the energy that we're expending. What are we doing on a regular basis to recharge our battery, to keep it fully charged? Like I said, studenthood is not conducive to taking weekends off and evenings off, right? And what are we doing to make sure that we're not running on empty? Because that's something that we need to ask ourselves, over decades, over years and decades, not just over exams this fall.
Yeah. Wonderful point, Dr. Dafoshi. Well, thank you all so much for joining us. This has been a really great and informative conversation that, if families weren't able to join us live and they're watching a recording, I think it's really timely and a great overview of how we can have better conversations with our students to support their wellness now and to help them prepare for next semester as well. So I hope you all have a great rest of your day. Thank you, families, for joining us. This recording will be posted probably this afternoon. I know it's very timely, and we have our newsletter coming out tomorrow that will really focus on closing out another fall semester and everything you need to know. So thanks again, and I hope everyone has a great day. Bye, everyone.